G'day, Dr. Teh again. Talking about cannabis medicine once more. Today I want to talk about the route of administration. How do you take your cannabis medicine? The most common form of ingestion of cannabis worldwide is obviously smoking. So in Australia, we don't recommend that from a medicine perspective in the sense that it's irritative to the lungs and throat, but it's a legitimate route and it's used throughout the world. Other forms of inhalation would be vaporization, and I think this is probably my preferred form of inhalation for cannabis medicines. You get a quick response to your medicine, so it can be almost instantaneous, or within 10 minutes you get your response of your medicine. You get a high blood concentration quickly, and then you get a reduction quickly as well. So you get a duration of effect, maybe 2 to 4 hours from an inhalation. Very good for panic attacks and anxiety, where you might have a small amount of indica flower, say, vaporize that and be able to get that calming effect of that indica flower very quickly. Probably my most commonly prescribed route of administration is sublingual or mucosal absorption. So that's where we just take cannabis oil drops or tinctures in our mouth and we hold them in our mouth for as long as we can before we need to swallow. Why do you do this? Well, it gives direct access to your bloodstream for these cannabinoid molecules. Goes straight in through the oral mucosa and into your blood. Some you will swallow, and things that you do swallow will then go straight into your stomach and go straight to the liver. What happens there is you get liver metabolism immediately. So the way I explain it to my patients is you're getting best value for your medicine when you hold it in your mouth and let it absorb straight into your body. It then has to pump around your body and it has effect before it gets to your liver again and starts to be metabolized. So sublingual and oral are often mixed together, but oral or edibles is another way to ingest medicines. A bit slower in onset. So sublingual and oral have the same pharmacokinetics in the sense that their duration of action takes, say, about an hour to come on. You get approximately 8 to 12 hours duration out of those medicines, and you get a more steady increase and decrease in your blood concentrations of cannabinoids. So I like to use sublingual dosing 3 times daily, and that gives me a cover of medication throughout that patient's body for the whole day. Dermal or external skin absorption of cannabinoids is also another possibility. Our skin contains many cannabinoid receptors throughout it, so it can be very useful in inflammatory conditions such as psoriasis. And in fact, Dr. Hergenrather, a renowned cannabis clinician from the USA, has used full extract cannabis oils on non-melanotic cancers, so things that aren't melanoma skin cancers, and then an occlusive dressing, so cover them up so they stay a bit moist. And he's found that this has actually caused those tumors or small cancers to fall off or slough off the skin within a few weeks' time of application of these extracts. It's very promising. One other area of application would be suppository. Suppository use is interesting. You get good blood volumes from this level, but you get a decreased psychoactive effect. There is some question as to how efficacious suppository methods are for dosing, but you do get absorption through the mucosa of the rectum there, and it's definitely an option, especially when trying to achieve very high dosing levels, such as in the case of cancer. It can be a very useful option. But generally, I think my 2 most used and favoured routes of administration will be inhalation and sublingual or mucosal absorption. So there's plenty of ways to ingest your cannabis medicine, and we can utilise these different ways to have specific effects for your disease state, helping you become a healthier person. Thanks. I'm Dr. Teh.